research going forward. So go ahead and watch this.
Go ahead, you can start eating. All right. She would constantly ask the same question. Perhaps not right immediately after having gotten an answer, but a little time after that, she would ask the same question. And I began to realize that there's something going on, but of course, I guess that comes with old age, although she wasn't that old.
There are a couple of myths shared by many people in society. First is that Alzheimer's disease is really part of normal aging. Clearly, it's related to the aging process, but it is a disease.
What I did yesterday, sometimes I do not remember. Or if I'm even in a conversation now, that I can suddenly block out and not remember anything that I've been planning.
This progressive and debilitating loss of mental capabilities is known as dementia. Non-Alzheimer's dementia can result from various causes, such as drug or alcohol abuse, head trauma, or stroke. Alzheimer's disease is believed to arise from some combination of genetic and external factors and growing old. It's responsible for the overwhelming majority of cases of dementia in the United States today.
Can you tell me where we are?
Oh yeah, this is Michigan.
Oh, okay.
There's no question about this being Michigan.
It's not Minnesota or Iowa or
No, this
Wisconsin?
is Michigan.
We're in Michigan.
This is
Okay.
Michigan.
Well, you can't simply decide tomorrow that you want 10,000 new scientists working in Alzheimer's disease. They simply won't be available. Now, the fact is that the current funding circumstance at the federal level threatens all of the young generation of scientists.
It's ironic, we never have had more promising treatment candidates now than we do, but this is the time where actual research funding is being constrained because of all the other demands on our national budget.
It just seems a tragedy that there's not enough spokesmen in Congress and the public that can really advocate, and get the priorities up higher for something that really is the future of the nation.
You survived the party. What? You survived the party last night.
For Earl and the millions like him, there are currently no approved medications or treatments to prevent, stop, or reverse the effects of Alzheimer's disease. In the face of this reality, it's reasonable to question the value of an early diagnosis.
So as you can see, there are just some of the people that had it. They definitely experienced confusion and memory problems. And like I said, there are a lot of clinical trials, but there are more people that are actually willing to participate in them, but the funds are not available. So the last part I want to talk about is not necessarily the Alzheimer's patient, but those who care for them. Like I said earlier, from the day of diagnosis, most people live roughly 8 to 10 years. And that is a long time for someone to be solely responsible for someone else. Alzheimer's has major emotional, physical, and financial effects on the caregivers and loved ones around them. A lot of caregivers experience burnout, health problems, and financial issues. They drain their own bank accounts caring for their mother or family friend who has this disease. So due to this, there have been a lot of state and local agencies that have developed programs to support people in the community. Currently in Pensacola, we have Alzheimer's Family Services, and they do provide respite care and support groups. Respite care is where they, usually for free or for a small price, provide someone to sit and care for the Alzheimer's individual so that the caregiver can go out and have some time to themselves, run their errands, doctor's appointments, such as that. And they also have support groups where other people who are providing the care for an Alzheimer's patient can just talk about their frustrations, things that work well, and such. So going over everything that we talked about, As I stated, Alzheimer's disease is not caused